Hello, everyone. Welcome to another special webinar for LAMP students. Today, we shall continue with our discussion for tongue diagnosis. The topic is tongue body color.
Mhm.
Okay, when we look at the tongue body color, this will give us information about the state and quality of blood yin fluids. So related yan ha. Blood yin fluids. Puro yan yin. Yang and qi. Related din siya. Okay? And so what do we mean by spleen qi deficiency? So pag deficient, the tongue body is pale. Why? Because the qi is weak. Deficient yung qi para mag-transport ng blood to the tongue. Okay, so spleen qi deficiency, the tongue body is pale since the qi is too weak to transport blood to the tongue. So the tongue looks pale. However, if the qi and yang deficiency is already serious, that means the blood is not moving, magkakaroon na ng blood stasis. So definitely, if you have a very serious condition of qi and yang deficiency, you will have blood stasis. Okay? And this time, the tongue is pale blue. Pale blue. Okay? So, blood deficiency, the tongue body is noticeably pale, but yin deficiency, it's more red or less pale. So, ito yung gusto ko ring the thing that you need to really also understand. But yin deficiency in its early stages may not exactly look red, but in fact, it just looks pale. But however, if you will compare yin deficiency with blood deficiency, the tongue body of someone with blood deficiency is very pale. So that means pag nag-yin deficiency na, blood is an aspect of yin. It will now become more red.
Mhm.
So later we will understand why. Because when you have yin deficiency, umiinit na, 'di ba? Tuyo na siya, 'di ba? So if it's still blood deficiency, the earlier status pa, it's still pale, so pale. However, it becomes less pale, more red, and then uh, our landmark, the thing that we have to be looking at here would be the absence of the tongue coating. Okay. Now, according to Machocha, the tongue doesn't exactly look red when it's still early. But after a few years, sometimes 10 years, it will turn red because we now have an empty heat condition. So that means if it's yin deficiency, nanggaling pa rin siya sa blood deficiency. Okay? So parang mas malala na yung yin deficiency, so it becomes more red eventually. Now, if you have disorders of heat and cold, they show themselves in the color of the tongue body. Okay? So, when we have an externally contracted heat entering the blood, ibig sabihin heat from outside coming in,
Mhm.
the tongue
Mhm.
body is now crimson red, dark red. Okay? So, if you see a tongue body that is dark red, diba, kaya nga, you have to always make sure that you take the picture of the tongue using natural light. Because
Mhm.
if you use light like this, no, you might see a dark red. So you'll eventually think, ay, nag-internalize na yung heat. Okay? So yun. If uh, cold naman, cold is can impair the chi and yang. Okay, 'di ba? Pag masyadong malamig, ayaw mong hindi gumagalaw, no, in the interior. So the tongue body will become noticeably pale. So, cold, pale yung tongue. Heat, dark, crimson red yung tongue. So, in conclusion, the tongue body color will tell us the state of qi, the yang, blood, and yin. So, parang yin and yang pa rin. Okay? Yon. So, this is the first thing that you have to look for. So, if you were able to determine na talagang yun ang kulay, then you are a good practitioner. Now, let's go to acute diseases. Acute means hindi pa umabot ng 6 months. The onset is sudden. Okay? the color of the tongue body provides an information about the pathogenic factor, how deep the penetration of the pathogenic factor has become. So pathogenic factor, as the name implies, is the one causing the illness. Ano? So if you have a continuing high fever lasting over a few days, this will turn the tongue to dark red. So that means nag-interiorize na. Pumasok na sa loob. Okay? Can you get it? So, pag mainit sa labas, 'di ba, it penetrates the most exterior pa, no? So this is where you have aversion to cold and also fever. Okay? Both simultaneous. However, if the patient now would remove all would throw away the blanket kasi mainit na. So if you look at the tongue, it's already dark red. So that means if you've been seeing the patient and then ganito nangyari sa pasyente, you're not a good clinician because you were not able to treat the patient well. So pag chronic disease, okay, chronic means something that's been there for quite some time. And the symptom is gradual. So uh, medyo matagal na rin. So tongue body reflects long-term pathological disharmony and when you have a constitutional weakness. So something that you have inherited from your parents. Okay? So again, the tongue body color is used to diagnose conditions of heat, cold, yin deficiency, yang deficiency, qi deficiency, blood deficiency or shuershu, and the state of the zangfu organs. It can give us an idea of how deep. Another name for pathogenic factor is qi, no? Paano siya how deep was the penetration into the body? And when you look at the color, you should always take a look at the shape of the tongue, no? After you look at the color, you should always connect it to the shape of the tongue. These two aspects cannot be seen separately from each other, and they are the single most important aspect of tongue diagnosis. Okay? In cases where you are not sure of your tongue diagnosis because of conflicting information, what you should do is you note the color of the tongue because, as we mentioned earlier or a long time ago, it is the most important aspect. Because the color of the tongue body reflects long-term influences and the underlying patterns of imbalance. So it's still the color. Kung na-confuse ka na, no? So there are 5 pathological colors that we need to really look into. We have pale, red, dark red, purple, and blue. Okay? So of course, we will not take this all up today, but we're going to give you an example. So here we have a 35-year-old male, came in with symptoms of frequent urination, turbid urine, huh? Turbid. Think of something dark, no? Lower back pain. Think of what? Anong isipin natin pag lower back pain?
Kidney.
Yeah, kidney. Constipation. Okay. So it's lower burner pa rin, no? Stomach pains. Yeah. Okay. Western diagnosis, the prostate is enlarged chronically. Chronic prostatitis, inflammation of the prostate. Okay. So when there is swelling, there's redness, there's pain. Okay. Background to disease, irregular eating habits. Okay. So anong nakikita nyo sa tongue? Let's take a look. So here, according to the tongue description, the tongue is pale, obviously, and it is swollen. Kung titingnan nyo, it's like super laki talaga siya. So what does this mean? Spleen chi deficiency, there's accumulation of dampness. Every time you give a diagnosis of spleen chi deficiency, you should always mention specifically what is the deficiency. Anong nangyari? So here you could see accumulation of dampness. So of course we can base this on the turbid urine, no? Diba? lower anything that will connect you with dampness. Okay? Damp yan eh. And then yellow, slippery coating at the posterior third. Posterior third is the lower burner, remember? Yellow, slippery is not normal. Okay, and remember that the patient is still young, 35, and so the diagnosis would be damp heat in the lower burner. So let's take a look. So you'll have two diagnoses. It's a mixed diagnosis, deficiency and excess. Do you agree? So, yung isa kasi, spleen deficiency, so nagkaroon ng excess. And then damp heat is definitely excess. So what is the... So, pwedeng mangyari na talagang may connect ang lower burner sa middle burner. Okay? So what do you have in mind? So if we're going to look at the symptoms, okay? It's basically the kidney, okay? So we have here yang deficiency, chi deficiency, yang deficiency, okay, which has affected the spleen. Or it could be, okay, okay, ito kasi, this is a very significant background, no? Irregular eating habits. What do you mean by irregular? Minsan, 10 a.m. kumakain ng breakfast, and the following day, naging 1 p.m. yung breakfast. Hindi ba siya regular? So, nako-confuse ngayon yung digestive system. So, and so it sends a negative signal to the kidney. Okay? So, not too many people realize that spleen and kidney, they have a relationship. Okay? So if you don't take good care of your kidneys, your spleen, okay, definitely this will be impacted by the kidneys. Or if you have an issue with your kidney, then you will have you will have an issue with your middle burner, the spleen. Okay? So obviously when you say turbid urine, that's in the lower burner, okay? Frequent urination, okay? So this is very yang deficiency or chi deficiency. We cannot say yang deficiency because the patient doesn't have feeling of cold. Walang feeling of cold. So siguro if you hold the patient's limbs, wala talaga, no? Walang cold kasi uh, una-una, the color of the coating on the posterior third is yellow. And yellow signifies heat. Okay? So there's damp heat. Where? In the lower burner. Okay? So turbid urine is definitely damp heat in the bladder. By the way, ano-ano yung mga organs? What are the organs found in the lower burner? Can you tell me? There's the small intestine, large intestine, the bladder, the kidneys, right? Am I correct?
Yes.
So you need to extract from the history of the patient. Kasi especially when you do the Zang organ pattern of differentiation here. So dito, we're not even sure kasi it's like the lower burner, no? So the lower burner is hindi sinabi bladder. Why? Because meron siyang constipation. Do you follow? Constipation, this is more common for heat. No? So constipation, we think of large intestine. Okay. Turbid urine, we think of bladder, right? Lower back pain, we think of kidney. Okay. So itong stomach pains, this is probably due to the fact that uh, may dampness, no? Mm. And so yun, hindi siya spleen yang deficiency because there is no feeling of cold. Okay? Any questions? Any comment? Sir Chobel, okay na? Yes. Ay, bakit biglang tumigil?
Yung stomach pain, doc, if there's a presence of stomach pain, it might be since lower
Oo.
burner siya, doc. It
Mm,
might be
mm.
that pain, doc,
Ah,
it's
ganit
because
yeah.
the impact of the bladder and some other areas of the
Oh,
lower, ano.
actually,
Yung
ganito po
pasyente ko
yan.
kasi, doc, Taiwanese, ano, doc, yun, mayroon siyang prostate hyperplasia.
Oo.
Sumasakit yung stomach niya. Yes. So, may pain. Nagbibigay ako ng pain reliever, pero yung nagbibigay din ako ng Splen na 15, I think.
Uh-huh.
Para oo, nare-relieve yung pain niya, doc. Tapos nawawala
Oh,
talaga. Tapos,
ah, wait lang. Ang prostatitis kasi, hindi ka magkakaroon ng stomach pain. Ang stomach pain kasi dito, I think, kasi 'di ba, ang stomach pati large intestine magkakakontsaba yan. 'Di ba? Yang.
opo,
So, obviously, may konting issue na talaga sa stomach. So, meron siyang constipation. 'Di ba usually pag stomach pain, hindi ka you know,
okay.
may heat eh.
Yes po, doc.
But
Chronic na kasi yung constipation niya, yun. Maybe.
but it's not because of the chronic may kinalaman din si prostatitis dito. Remember there is like uh, the prostate kasi is in Chinese medicine, it's part of the bladder. It's part of the
Okay.
lower burner. So kaya dito kung nakikita nyo, it's more encompassing, no? Dump heat in the lower burner. So that means yung sinabi ko kanina, the large intestine, the small intestine, the kidney and the bladder. So you need to and lahat 'yun nandun eh, no? But
Opo.
it's because of this one, the chronic prostatitis. But in Western medicine, we don't say na, okay, it's good to know na meron kang pasyente na ganito talaga. No? So did you look at the tongue?
Hmm.
Hello?
Yes po.
Oo. So yung pasyente mo ba, did he have prostatitis?
Yes, doc.
Okay.
Prostate enlargement, doc.
Okay. So that means when you have prostate enlargement in Chinese medicine, the whole lower burner would be affected. No? Ano ba yun nasa
Yes.
lower burner? Um, andun yung bladder, yung kidneys. Alam natin that the prostatitis is prostate is under the realm of the bladder.
Yes po.
Bladder gland. So, nakapulupot yan sa dun sa andun siya, nag-encroach siya sa urethra. Eh. No? So that's still part of the bladder. And also, uh, kasi may heat, no? Kasi tingnan nyo, may dampness. This is probably due to the irregular eating habit, so that caused the turbid urine. And also, may constipation because probably may kinalaman din ito kay prostate, no? Kasi the whole
Mm.
lower burner is affected.
Mm.
I hope that makes sense.
Yes
So,
po, doc. That's
is
maybe, doc, the sense of that stomach pain exists. Kasi
yes.
doon sa maraming
Oo.
concern na po sa lower.
Oo.
Ano?
Kaya, if you go to somebody else, iba yung titingin sa stomach mo, iba yung titingin sa prostate ng pasyente, iba yung titingin sa lower back pain, iba yung titingin sa ihi. Expensive, di ba?
Oo.
So if we can probably, so if you have the diagnosis like this one, um,
Yeah.
you tonify the spleen, especially if we go to the topic where um, pag deficient ang spleen, we tonify it. Especially if we already know the 4-point needle technique, then we would be able to know what to do, you know? And you
Mm.
need to drain the dampness. So we have points that will drain the dampness, like spleen 9, uh, Ren 12, Ren 9, you know? So yung mga ganon. You will all get to know to learn. You will get to know this. So here we are showing to all of you that may connect talaga ang middle burner sa lower burner. Okay?
Mm.
So no palpitation, so we don't see any walang cough. So yun. Frequent urination, isipin mo kaagad, ay, bladder, kidney. Oo, kasi hindi, mahina ang kidney talaga. Um, hindi niya makontrol yung urination. Okay? The kidney,
Ito lahat, Doc, sa sabi. Yes po, Doc.
yeah. So of course, if the kidney is affected din yung bladder, no?
Opo.
Kaya may damp heat tayo. Yun. Turbid urine. Yung hindi clear yung urine, turbid. So think of damp already. And then, yun. And I think the reason why nakuha dito yung, aside from constipation, is if you look at the coating of the tongue sa posterior third, it's yellow. Slippery means dampness. Yellow is heat. At the posterior third. So damay-damay na lahat. So I hope that's okay, everyone. Are you happy? I do not want to confuse you with a lot of tongues. Okay lang.
Yes, po. Thank you.
Thank you so much for your time.
Thank you, Doc.
Thank you so
Okay,
much.
Doc. Thank you din.
So I hope you'll be ready looking at your patient's tongues.
Um,
Uh,